Hello from Ottawa. My name is Dr. Timothy Iman, and today's date is December 4th, 2020. The issue of euthanasia, or medical assistance in dying, MAID, as we call it in Canada, is once again before Parliament. The MAID legislation was initially introduced in 2016 and legalized. At that time, safeguards were implemented to ensure that vulnerable Canadians, Canadians with disabilities, children and youth, and people with mental illness would be protected within this law. These safeguards were intended to ensure that these vulnerable groups did not choose MAID because of undue influence, coercion, or simply because healthcare has failed to meet their needs. However, just 4 years into the MAID experiment, our judges and politicians are deeming these very safeguards as unconstitutional and are spinning them as discriminatory towards these vulnerable groups. There is a real possibility at this point that the safeguards which prevent the law from being applied to people with mental illnesses will be removed by the Senate. As a psychiatrist who works with children, youth, and their families, I'm very concerned about where this legislation is heading. The professional opinion among psychiatrists in Canada is rapidly shifting. In 2016, the Canadian Psychiatric Association strongly advocated to protect our patients from MAID. Today, psychiatrists are advocating that it would now be discriminatory and cruel to withhold MAID from our patients. Let's not forget the history of psychiatry over the last 150 years. Psychiatrists have not always gotten it right, and when our profession has erred, we have done terrible things to people. A serious misjudgment of the lawmakers is that Bill C-7 can be flawlessly enacted by our healthcare professionals. Despite our best efforts, my colleagues and I make error judgments. This will be the same in our administration with MAID. There will be people that we euthanize to relieve psychic distress who might otherwise spontaneously improve as part of the natural course of their illness, or for whom a meaningful change in their life circumstances will bring relief. There will be those people that we euthanize not because their condition can't be treated, but simply because the treatments we offer them are not acceptable. Did you know that electroconvulsive therapy, ECT, continues to be one of the most effective treatments for major depressive disorder? And yet, many people are reluctant to consider it based on how it's been presented by Hollywood. For those people who are willing to consider ECT, it can be difficult to access as it's a hospital-based resource and waiting lists to access it are long. Maybe you haven't experienced it personally, but I suspect you've heard from someone just how hard it is to access high-quality mental health care in our country. Did you know that suicide is the second leading cause of death among adolescents and young adults? In many First Nations communities, it is occurring at epidemic proportions. Within the Canadian population as a whole now, MAID has is projected actually to result in nearly double the number of deaths that independent suicides do. Do you know that MAID is projected to save the Canadian taxpayer $149 million in this year alone? And that's with the safeguards and the restrictions in place. Given the massive debt burden that we come out of the pandemic with, I'm sure that governments will be welcome to accept cost savings anywhere they can be found. Did you know that the lives of those with mental illness continue to be discriminated against in Canadian hospitals? I can honestly tell you that there continue to be many doctors and healthcare personnel who don't give two hoots about the actual lives of people living with severe and persistent mental illness. I distinctly recall a moment of my own training when a fellow learner, who is now an anesthetist, commented that he found it ridiculous that we psychiatrists should seek to preserve and improve the lives of people who are depressed and wanting to kill themselves. He was clearly irritated by whatever disturbed or unpleasant personalities he had experienced in his life, but he sincerely believed that we should just let them die if their lives are that bad. Unfortunately, this attitude persists within the Canadian medical system and, to some degree, within Canadian society as well. There will be healthcare providers who are more than happy to assist in the deaths of my patients, the mentally ill. And these providers will cloak their disdain for these people as kindness, compassion, and will set themselves up as the defenders of their basic human rights. Now, I labor in the profession of psychiatry to bring hope to children, families, and adults. Thankfully for many, their suffering resolves because I've seen enormous suffering. Their suffering resolves sometimes because of the psychological and medical therapies that I and my colleagues provide. Sometimes it resolves simply as their life circumstances change. However, I have met many kids whose lives are marked by severe trauma, abuse, neglect, and tragic loss, which leaves them feeling chronically depressed, chronically suicidal, and chronically hopeless. And they continue to feel this way in spite of our best efforts to use hospitals appropriately when needed, to use medications, and to offer therapies. The legal experts, unfortunately, as well as the medical ethicists, are now saying that I will have the ethical responsibility to inform these patients of mine that they can have access to medical assistance in dying. Look, young lady, you have been fighting a hard battle for many years. We've had you in and out of hospital multiple times, and you had a difficult childhood. I'm sorry the medications haven't worked, and you're doing the best that you can. I guess at this time I'd be happy to offer you another medication to try, maybe one that you haven't tried already. Maybe we can talk about some different types of therapy, but I also want to let you know that I'm happy to help you pursue a medically assisted death if that's what you'd like. If this is what the ethical practice of psychiatry is becoming, I am happy to do something else with my life, because this is nonsense. Please do physicians and psychiatrists like myself a big favor. Write to your senator and request that they act in the interest of the public good by ensuring that the mentally ill remain protected from euthanasia. Thank you very much.